Today, I will show 3 simple exercises that increase blood flow to your legs and feet. No equipment, no gym. Do these daily and you may feel less heaviness, fewer cramps, and better recovery. Healthy blood circulation in the legs and feet is essential for carrying oxygen and nutrients to the muscles, skin, and nerves. When circulation slows or becomes blocked, the tissues are deprived of the fuel they need, which can lead to pain, cramps, numbness, or even serious complications over time. Poor circulation is often linked with conditions such as peripheral artery disease, diabetes, and chronic venous insufficiency. These issues can increase the risk of wounds that heal slowly, infections, and in severe cases, tissue damage. Warning signs to watch for include persistent cold feet, tingling or numbness, shiny or discolored skin, hair loss on the legs, swelling in the ankles, and pain in the calves during walking that improves with rest. These symptoms should not be ignored because they can signal an underlying vascular condition that requires medical attention. Recognizing these early signs is the first step toward preventing complications and improving overall vascular health. Walking. Walking is widely recognized as the single most effective exercise for improving circulation in the legs and feet. It is low impact, requires no special equipment, and can be adapted for almost any fitness level. Walking strengthens the muscles in the lower limbs, stimulates the natural pumping action of the calves, and encourages the development of small blood vessels that help bypass blockages. Over time, this regular movement improves endurance, reduces leg pain, and increases oxygen delivery to the tissues. How to do it, step by step. Begin with a short warm-up by walking slowly for 3 to 5 minutes. Increase your pace until you reach a brisk but comfortable stride. A good rule is to walk at a pace where you can still talk but feel your breathing become deeper. If you feel mild discomfort in your calves, pause and rest until the pain eases, then continue walking. This stop-and-go approach is especially effective for those with circulation problems. Aim to build up to 30 minutes of walking most days of the week. Beginners can start with 5 to 10 minutes at a time and gradually add more minutes as strength improves. Finish with a cool down of 3 to 5 minutes at a slower pace, followed by gentle stretching of the calves and ankles. A sample plan might include walking for 10 minutes, resting for a minute if needed, and repeating this cycle until you reach your daily goal. Over time, the goal is to extend each walking session until you can complete 30 minutes continuously, several days per week. Consistency is the key. The more often you walk, the greater the long-term benefits for your circulation and overall leg health. Calf raising. The calf muscles are often referred to as the peripheral heart because of the critical role they play in pushing blood back up from the legs toward the heart. Each time the calves contract, they squeeze the deep veins in the lower leg, forcing blood to move against gravity. This action is called the calf pump, and when it works effectively, it helps prevent blood from pooling in the feet and ankles. Stronger and more active calf muscles mean a stronger calf pump, which reduces swelling, heaviness, and fatigue in the legs. Research has shown that regular calf-raising exercises can improve venous return, decrease symptoms of chronic venous insufficiency, and enhance overall lower limb circulation. Step-by-step demo. Stand upright with your feet hip-width apart. Place your hands lightly on the back of a chair, wall, or counter for balance. Slowly rise up onto the balls of your feet by lifting your heels as high as you comfortably can. Hold this position at the top for 1 to 2 seconds. Gently lower your heels back to the ground in a slow and controlled manner. This completes 1 repetition. Aim for 12 to 15 repetitions per set, resting briefly after each set. Perform 2 to 3 sets in total. To make the exercise easier, it can also be done seated. Place your feet flat on the floor, then press through the balls of your feet to raise your heels. To progress, try single-leg calf raises, or add resistance by holding light weights in your hands. Calf raises can be performed almost anywhere, and consistency is more important than intensity. Over time, these exercises not only strengthen the muscles, but also train them to work as a more efficient pump. This directly supports better venous return, lowers the risk of fluid retention, and helps maintain healthier blood circulation throughout the lower body. Ankle pumps and toe or heel raises. Ankle pumps and toe or heel raises are among the simplest yet most effective exercises for improving blood circulation in the lower legs and feet. These movements directly engage the muscles around the ankle joint, which helps activate venous return and prevent blood from pooling in the lower limbs. They are especially helpful for people who spend long hours sitting at a desk, traveling on airplanes, or recovering from illness or surgery. Clinical studies have shown that repetitive ankle pumping increases blood flow velocity in the veins and reduces the risk of clot formation, making it a safe and accessible exercise for almost everyone. Step-by-step demo. Sit comfortably in a chair with your feet flat on the floor. For ankle pumps, point your toes forward, extending the ankle, then pull your toes back toward your body. Hold each position for 1 to 2 seconds. Repeat this movement 20 to 30 times per set. For toe raises, keep your heels firmly on the ground and lift your toes upward as far as possible, then lower them back down. For heel raises, keep your toes on the ground and lift your heels as high as you can, then lower them back down. Perform 2 to 3 sets of each variation. These can be done multiple times per day whenever your legs feel stiff or heavy. These targeted movements are easy to integrate into daily routines. For example, you can do them while working at a desk, watching television, or during travel. Consistent practice helps to maintain mobility, reduce swelling, and keep circulation flowing even during long periods of inactivity. It is generally safe to perform these 3 circulation-boosting exercises every day. Walking can be done most days of the week, while calf raises and ankle or toe and heel exercises can be practiced 2 to 3 times per day in short sets. For progression, gradually increase the number of repetitions, add more sets, or introduce balance challenges such as performing calf raises on one leg. Resistance, such as light dumbbells or resistance bands, can also be added to make the muscles work harder over time. However, it is important to know when exercise alone is not enough. People with diabetes, peripheral artery disease, or chronic venous insufficiency should consult their healthcare provider before beginning a new program. Those who have recently experienced deep vein thrombosis, or who have wounds, ulcers, or severe leg pain, should avoid unsupervised exercise until cleared by a clinician. If symptoms such as persistent calf pain, sudden swelling, or skin color changes appear, professional medical advice should be sought immediately. Safe and consistent exercise, combined with medical guidance when needed, ensures that circulation can be improved without unnecessary risks. These precautions allow people to gain the benefits of stronger, healthier legs while preventing complications.